Can you hear me?
Yes, we can hear you.
Okay, gotcha. Hey,
Hello.
Susie.
Thank you so much
Hello,
for being here.
lady.
All
Should
right.
we let everyone in?
Yes.
Okay.
So just really quickly, Mr. Dai, we're gonna let everyone in now, and I'll give short introductions, and then go ahead and ask some questions, and we'll get started.
All right.
Wonderful. All right. Hey everyone, thank y'all so much for coming to Girl Up North Texas's Menstrual Health and COVID-19 webinar. We are so lucky to have been joined by an incredible group of panelists, and we're gonna go around and introduce ourselves, but for now, we would really love for y'all to turn your cameras on. The session is being recorded, but we're trying to get a lot of engagement from the chat throughout the session, so feel free to ask questions or any comments or inquiries that you have. We have a really great lineup here, and super excited to have some conversations today. So our panelists together, we have groups of Girl Up members, menstrual health activists, organizations already existing in the space, and to all those individuals that are here looking to learn more, welcome. So I'm Shreya Tama, and my pronouns are she, her. I'm the former Director of Inclusion and Diversity, and currently the president of Girl Up North Texas, and I will be your co-moderator for today's webinar.
Hello, everyone. I'm Isabella. I'm the upcoming president of the North Texas Girl Up Coalition. My pronouns are she and her. I will be co-presiding over the coalition this year, and I am also the co-president of Woodrow Wilson High School with Sarah Valencia.
All right, and we are also joined by Shira. She's going to go ahead and give an introduction for herself now.
Hello, everyone. Thank you so much for joining Girl Up Edinburgh's webinar series entitled Exploring COVID-19's Intersectional Impact on Women and Girls Worldwide. So we've been joined by Girl Up campuses across the globe, including Girl Up North Texas, who we are so excited to be, who are putting on, I think, what is the 8th session in our webinar series. We have 2 more sessions this week, so please head to our Instagram, head to our website. I'll drop all of that into the chat, but we are so excited to be engaged in this conversation with you. And just to reiterate what your co-moderators have said, have just mentioned, we really want to make this as interactive and as engaging as possible. So message in the chat if the conversation is going somewhere else, but you have a comment you want to share, please go ahead and put it in there. We'd love to engage with all of you. So as always, follow us on Instagram, tag us in all of your social media, and I'm going to leave it up to you guys. I'm very excited.
All right, and I also just dropped in the chat, we have some really amazing translators along with the Girl Up Edinburgh team that are actually translating everything that we're talking about in Spanish live. So if y'all need that, feel free to check out the document that I just sent in the chat. All right, so of course, today's conversation, our excellent panelists.
I'm coming. I got some technical difficulties.
Okay, no problem.
Can you hear me?
Yes, we can hear you, Ms. Jindai. All right.
Okay, I'm here, but I can't. Can y'all hear me now?
Yes.
I can't hear you. Hold on.
Maybe try jumping back in. Okay. All right. I guess we'll start with introductions. Isabella, as soon as she comes back in. Okay. Isabella, do you want to go ahead and start introductions? Yeah.
Okay. All right. So Ms. Jindai is a transformation advocate who has been an active member of various communities empowering youth and adults for more than 15 years. Jindai is the owner of Empower You, based in Dallas, that celebrates and educates women and girls about reproductive health and self-esteem, including our menstrual cycle and hygiene management. Jindai received her BA in psychology from Prairie View A&M and her MS in community in community psychology from Florida A&M, and currently serves as the community liaison for Dallas Independent School District. She strongly believes that a healthy community starts with the people in it. Consequently, her personal mission is to heal the world one community at a time. I actually met her at the Texas Veggie Fair, and she was promoting sustainable period products, which was really cool, and that's how I got in touch with her.
All right, we also have here Miss Karen Sugar of the Healthy Periods Initiative. So Karen is the founder and director of the Women's Global Empowerment Fund. After completing her master's thesis on the power and possibility of microfinance in 2008, Karen launched WGEF. Karen and her mission extend internationally, providing tools and programs to create economic, social, and political agency for women and families in northern Uganda and Haiti. Recognizing the sudden lack of access to hygiene products and barriers to menstrual hygiene since the lockdown, WGEF partnered with the Ugandan government's district task force to distribute 8,000 sanitary towels to girls and women since April. Karen's work has been featured in the Huffington Post, the Foundation of Global Scholars, and more, and we're so lucky to have her with us today.
Next, we're going to introduce Dr. Jessica Shepard. Dr. Shepard is a board-certified OBGYN, women's health expert, and a minimally invasive surgeon who currently practices at Baylor University Medical Center in Dallas, Texas. Her passion for women's health has allowed her to be an advocate for conditions such as fibroids, endometriosis, and healthcare disparities, and found her viewpoint to encourage discussions about such topics with her patients. She's an engaging and well-known media personality, seen regularly as an expert on Good Morning America and The Today Show and more. I actually saw Dr. Shepard on The Today Show and thought she would be amazing for this panel. As a board member of the Women's Health Organization, American Heart Association, and more, Dr. Shepard is a passionate advocate for women as she continues to create pathways for women to be in their best health.
Right, and finally we have Ms. Jessica Norden. She is the founder of Chowpatty, a community organization providing period products to those in need and pushing for menstrual health education and advocacy. Jessica actually learned about the practice of Chowpatty on her trip to Nepal in 2016 and found that it was a tradition of shunning women and young girls to cattle sheds and huts for up to 2 weeks while they're on their period. So since founding Chowpatty earlier in 2020, Jessica and her team have actually collected and distributed 19,000 sanitary products to the homeless domestic safe houses and women's shelters across North Texas. Post-COVID, they hope to distribute supplies in Nepal. Jessica did her undergraduate in linguistics at UT Arlington and went on to do her master's in psychology at Capella University. She brings her knowledge and experience to the menstrual space to ensure that everyone has the right to have their period with dignity and in a safe environment. All right, so why are we here today? As we all know, 2020 has already been quite a year. The intersection of COVID with the resurgence of the Black Lives Matter movement and a call for accountability on behalf of many organizations and INGOs in the women's empowerment space has brought many important conversations on the front lines. Across the world, women, young girls, and non-binary menstruators already face disparities in proper access to healthcare due to gender discrimination, cultural taboos, lack of access to hygiene products, and insufficient care on education. So today's panel will delve into how these issues in period poverty have been aggravated by the COVID-19 pandemic globally and what menstrual equity means for the communities our panelists serve. So as Shira echoed, this is a space that we've created to discuss these issues openly, collaboratively, and honestly, in hopes to inspire you all to take action wherever you are and at whichever level you find possible. Once again, we will be taking questions, so please drop anything you'd like to ask our panelists throughout the conversation in the chat below, and we'll try to loop them in. All right, so to kick off today's conversation, I will be going around and asking initial questions to each of our panelists, and we'll, like I said, have some time for general conversation from the audience afterwards. So I want to direct my first question to Ms. Karen Sugar. From your experience, have you noticed a shift in your work in the menstrual equity space in Uganda since the onset of the pandemic, from product distribution to raising funds? And if you could tell us a little bit about what sort of hard truths have you had to face because of these changes?
Well, where we work is a post-conflict region. I mean, 10 years into the, post-conflict, so it's improving and it's less vulnerable, less tender. So we already work in a really difficult environment, but we've been able to make so many great strides, especially around the issues around menstrual health. We produce a product locally sourced and locally made, so we've been able to continue to make the pads. I think the difference is, I think some of the hardships that women face globally, but exacerbated in a peri-urban kind of very rural setting where we work, is isolation and lack of access even further. So you see, we also work with gender-based violence issues. So we've seen a lot of women experience gender-based violence, which is a global phenomenon, which we could discuss, even including the United States and many other Western countries as well. Girls aren't in school. So the Healthy Periods Initiative has actually distributed almost 4 million pads to 16 schools across the region, and we do it monthly. And we can't do that now because of the lockdown, so no one's in school. So you have all these girls at home that aren't getting the products that they need, that they, were really getting used to having and feeling so, feeling much better about their periods and managing them in a much more healthy way. So we've had to kind of regroup and distribute them to people's homes, to villages, and at our resource center called Gula Women's Resource Center. So we can't get to all those girls, right? So there are girls experiencing, menstrual health challenges because of COVID. And, the isolation part, it should not be overlooked, because that's a really huge challenge for women and girls, is to be isolated. So you've seen spikes in you've seen spikes in depression, you've seen spikes in actually girls having to sell themselves to get money to buy food. So it's a very food vulnerable region that we work in, and COVID only exacerbates that as well. We've seen an uptick in early marriage. So we're kind of fighting those fronts as well as menstrual health, because they are all inextricably linked, right? I mean, as we know, menstrual health is linked to human rights, economic justice, environmental justice, and we're kind of hitting that on as many fronts as we can. With regards to funding, that's probably our biggest challenge. We have the capacity and we have the program, we have a proven track record, we have the community, but raising money in this time for nonprofits and projects like this is definitely very challenging for me as the executive director, and for my director in Uganda as well. So we've actually, since April, had over 100,000 pads distributed to families, women. We take pads to villages and their homes and farms, and then we also distribute them from Gula Women's Resource Center as well. I think one of the really cool things that helps us and kind of is helping us get through this is that we have a really strong focus on leadership development, which is threaded through our entire program. So we have over 500 women serving in leadership capacity positions across the region. And that helps us continue to have menstrual health on the forefront, right? To address the issues in a community sense. NGOs aren't the answer to anything. It has to be civil society. It has to be community-based. It has to be wide-ranging, and it has to be inclusive. And so I think having that leadership development component has really served us well, which I wouldn't have ever imagined, because I could have never imagined a global pandemic like this. But it really helps us during this time as well. Uganda is still, kind of not experiencing a high number of cases yet, and who knows where it's going to go. It's so they've actually lifted the lockdown on business activity and transport, and so they're seeing an uptick in cases. So we'll see if girls will be back at school in the fall or not. We'll see. But those are some of the challenges that we face and some of the issues that we deal with.
Yeah, thanks so much for bringing that to light. I think it's really important to take into account all of the other factors that are involved. Like you said, racial justice is inexplicably tied to menstrual justice, as is environmental justice.
And
Yes.
economic. I mean, we have girls that literally have to go, you know, are doing things that they never could have imagined to buy, so they can buy food and sanitary products, right? Or you know, it's all linked, and it has to all be addressed and talked about as one thing. Although you can compartmentalize and really focus on different things and make a difference in certain ways. I think, you know, again, another thing that really helps us is that we locally produce this product. So our supply chain has not been interrupted. And our production has not been interrupted, because you can't ship anything over there. That is not a sustainable, you know, framework. So because we source everything locally and make it locally, you know, it works. It helps us continue our work. Yeah.
Yeah, and to have that sort of framework and structure planned out, even through this pandemic, I'm sure it's been a really great support system.
Yeah. Yeah.
Thank you so
I mean,
much.
you know, it's definitely hard to reach everybody, but we do have some tools at our disposal, because the program is so amazing and so thoughtful. And then our community leaders really help us to make sure that it has a high impact and gets to the, you know, meets the needs of schoolgirls. And basically we've been able to keep, you know, girls in school much longer. And that's the point, is that if you can keep a girl in school longer, she has a much better success rate at creating a healthy and sustainable future for herself. And so you see that, you know, it's the third major reason that girls drop out of school is menstrual health, and after poverty and early marriage. So, you know, and again, those things are all linked, right? So if you can keep a girl in school longer, then she can avoid those other pitfalls.
Yeah.
So that's the objective of this program, right? Is health and creating a better and more viable future for these girls.
Definitely. That's incredible. Let's keep that mulling in the back of our heads. Yeah. Thank you. All right. Now I want to move over to Ms. Jindai. So Empower You Period's focus lies largely in community-led grassroots movements for sustainability, alleviating the period taboo, and menstrual education. And we've seen through social media that y'all are continuously partnering and working with so many other orgs in the area. So kind of following along this idea of, well, how do we bring in leadership development? How do we bring in sustainability goals? I'd love to hear from you about your focus on topics such as sustainability and education, and how you found community engagement to be a supportive tool, especially since COVID hit Dallas.
Well, since COVID hit Dallas, it definitely has been challenging because our focus is primarily inner city girls. So what you once had, like access to the schools and different organizations and even different businesses, I do a lot of pop-up shops where I am an exhibitor in various events and things that are happening throughout the city. So naturally, when COVID hit us, you know, that was a few steps back. And so I guess for me, working like boots on the ground, it makes it more challenging to get to those caregivers and those girls. You know, I don't have the same access. So I've just been kind of hitting it on the front. My inbox is still ringing, okay? and or the text messages come through, or people call me about menstrual health and hygiene, like all the time, because I'm referred in different segments and different, you know, different areas. So menstrual hygiene is a very big deal. That's why I focus on reproductive health and self-esteem, especially with inner city girls and their caregivers. One of the things that I've learned being on the ground is working with them. When a girl is confident about, like the way that a girl starts her moonshine, as I like to refer to the period, you know, you can go back and check her self-esteem. You know, girls who had it, you know, just kind of like, here's the box, go in there and look at the pictures and insert it, you know. It's different from a girl who was welcomed to her moonshine by, you know, her mothers with gift bags and the talk with other sisters and things like that. So I really miss that, because that was me on the ground, you know, being able to provide those things with them. Our PAD project is different as well, because our Because She's Worth It campaign focuses on educating them about the use and the importance of plant-based period products, natural products, because we know what's in the other products. But because the numbers are so like ridiculous, people are trying to get it out as best we can to make sure that everybody has something. Whereas for us, it's just not an option because I know the long-term effects of it. So that definitely makes it harder too, because the donations and the funding doesn't look the same when it comes to people donating period products to give back, which is why I make it accessible on my website for people to purchase and donate through our website. And then we give it back like to the girls. We were also hit in distribution because what I do is provide reputable brands. I mean, I promote the use of reputable brands when it comes to natural period products. And most of my girls were hit. You know, they were hit. The Honey Pot Co., Tail Feathers, like all of these organizations got hit as well. So the distribution shifted. So even with trying to put it out there, you're trying to sustain a business, you're trying to run the campaign so that the girls don't miss out, but also keeping your lights on too was like really hard, like since the pandemic. But it's kind of woo-saying itself now. You know, it's just now you got to go back and kind of rally the people like, hey, we're back. You know, it never stopped for me, but for a lot of people, they went into shutdown mode, you know, and so now you have to like go back and gather the troops to get them to understand the importance and why we have to make that shift for the use of natural period products, especially catching our girls early. And when it comes to the Because She's Worth It campaign, rallying people around that cause to be able to distribute those natural period products versus the mainstream ones is like what the primary focus is right now. And also just keeping menstrual health coming, because what I'm learning is a lot of grown women, especially fathers, because it's such a taboo to include these daddies, you know, into menstrual health, which has to stop, you know. But for the caregivers, they don't even know like that there's so many options. They're reusable period products. They're natural products that are chlorine free. They don't, contain like all these pesticides and things like that. So when you start talking about menstrual health, it includes the types of products that girls have access to. A lot of us just know pads and tampons, and you know, it's so much more bigger than that. So something like that, it has to continue, and I'm going to make sure of it on my end anyway. Okay, you know. So yeah, those are like the ways that we've been affected. It was distribution with natural period product companies that were like on the ground, so they got hit, which means I get hit as a business owner, but also my Because She's Worth It took a hit as well because we were not able to distribute as widely as we typically do because I'm not able to be in the streets. I'm kind of like the high heel boots on the ground, honey, you know. And so when the pandemic hit, it took that away from us, you know. So yeah, that's what it looks like on our end, not having access to the people and the product. And then when they come to you online, it's like you have to wait because of the types of products that we disseminate.
Yeah, thank you so much for bringing those issues to surface, because I think that for us as consumers, or for me at least, for the majority of my life, it was always just go to the store and buy it and then don't really think about, you know, all the steps in the process that are involved.
Mm-hmm. And also too, a lot of people, I decided to cater to inner city girls because a lot of the period companies, they're catering globally, which is definitely needed. But the momentum is not as hard right here in our own neighborhoods. And that's why I chose to start at home, because I worked in inner city high school. I'm no longer the liaison within Dallas ISD, but I still work with those same girls. I still work with these same organizations, your YMCAs, your cultural centers, you know, and things like that. But especially working in those inner city high schools, and those girls are having to leave home because they're on their period. You know, whether it be they messed up their clothes, whether it is that they're cramping because they don't know how to cater to themselves when it comes to their moonshine, they were going home, you know. And so addressing that self-esteem and her reproductive health, it created a shift in the schools. The girls will come to me before the nurses because I'm going to not only just have the product that they need, I'm able to give them that education that they need for them to have a happier period, to say the least, you know.
Thank you so much for all of your work, from the emotional support to this distribution. I know it means a lot to everyone that you work with. And I know that there's a lot of people on this call who are from Dallas. So if y'all are able to, like, please support organizations such as Empower You Period or the Honey Pot Co. Buy sustainable menstrual hygiene products. If you can support where your communities are at and put money where your mouth is, you know, and work in that sense. that's incredibly important. It's like the most, as Isabella and I say, like the most grassroots or basic form of advocacy.
Absolutely. And Empower You Period, honey, it is the target of all menstrual health care, natural products in one place, you know.
Yes. And for everyone here, we're going to be sending out an email, like a follow-up email with donation links and all of these social media websites for y'all to check out after. All right. So let's continue to take this path of...
Can I make a comment? Is that allowed? Can I make a comment really quick?
Go ahead.
Before we kind of move on, you know, the economic justice point is proved by what our speaker just said, because the thing about organic and natural menstrual health products is they're very expensive as well. They're not. And so, you know, when you're on a serious budget, those things can be constraints
Yes.
to having healthy products. And as women, we need to do a better job of advocating that all menstrual health products should be healthy. And we need to put pressure on these companies to stop making things that cause cancer. I mean, it is incredible. And poor women or underserved women should not have to buy the cheap stuff. So, you know, and then wealthier women can afford to have the, you know, organic stuff. And the education that goes along with it. So there's that economic justice piece, and that is women, no matter where we are, we have to do a better job of advocating for better products.
Yes, indeed.
Anyway, I'm sorry, before we forgot, you know, some of that, I just wanted to say that, so.
No, thank you so much. I really love how we're continuing to bring in all these angles. Isabella?
Yeah, sorry. Yeah, I totally agree. Organic products and products that don't cause diseases down the road, super, and even like sustainable products, it's super important. So now we're gonna dive into a more intersectional lens on menstrual equity and hygiene. I wanted to direct my next question to Dr. Shepard. Given your professional experience and knowledge in the field of women's health, I would love for you to share how you've seen access to medical care for women be limited since the pandemic, and if possible, shed light on the disproportionate access to such health care that Black and Brown women especially face.
Yeah, absolutely. First, I just wanted to thank you for the invitation to be here today. I think this is a great forum where we can share ideas and get questions answered. But as a gynecologist and OBGYN, one of the things that we struggle with, especially during a pandemic, is access to care. And if you look at the numbers, there's obviously a disproportionate amount of Brown and Black girls and women as well, that have access to care, but also healthcare. So when we think of public health, we know that public health is a racism issue because it has shown in every study, you know, the amount of people that have certain conditions and diseases or deaths. And specifically COVID, it really has placed a magnifying glass on how that impacts the health care disparities and racial inequalities that we have, because we're seeing more people being impacted who either don't have the access or who don't have the means to get the care that they need. So when we compile and take all of that externally and bring it down to a topic of women's health care, during the pandemic, we did see an increase in the amount of issues, whether it's with fibroids and heavy bleeding or endometriosis and pelvic pain, more of an uptick of patients who are not getting the care that they need because not having access to the doctor's office. So one of the things that we did in our field or in medicine was how do we create access without putting people at risk, which was telehealth. And so just like we're doing here, you've seen a lot of this transpire with how we communicate now and how we share ideas is through the ability to share that virtually. And so we carry that out into the office setting where now I was able to see people in different states who usually were able to travel to Dallas to see me, or even my established patients. We saw that they had the access to care, the best that we could give them outside of an office visit by using telehealth. But, listening to the conversations prior to mine is we do have, when we think of reproductive justice and reproductive health inequalities, we do know, again, that there is a very level that does not appreciate brown and Black girls. And those are things that we have to stay mindful of, especially as a healthcare provider, is making sure that we're in tune with that. And a lot of the racial inequalities that have come up during this time, we have had marches. After George Floyd, we had a White Coat for Black Lives march, which was very impactful, because we do see that there is a healthcare issue when it comes to addressing certain conditions and healthcare diseases that affect certain communities. And so when we think of periods, fibroids is probably, if I were to kind of connect it to the discussion that we're having today, is probably one of the single factors that you can think of a disease that impacts African American women at a greater amount and a greater percentage, but yet when we see that follow through and the care and the options that they're given, you see that's where the disparity is. So as a Black female physician, there's only 2% of us in the entire medical field in the US. And so that's, that speaks volumes, and that's another place where we have to make impact known, because representation matters. And so when people are able to see me and know that I look like them and I can give them the care that they need, that's powerful and that's impactful. So I'm hoping that today, through the discussion, that we can generate ideas or ways that one, we can call to action, have a call to action of how we can allow for Black and brown girls to have more access to, whether it's products, whether it's healthcare advice, whether it's power to the pelvis. That's probably one of my things when I speak, is the power of the pelvis and how important it is for us to be empowered by who we are, and also starting that at a younger age, because many times when I see women in their 30s, 40s, even 50s, there is a shame and kind of guilt when it comes to their pelvis. And so if we can start that message of power to the pelvis very early on, what we'll see is as girls go into womanhood, is that they're not so scared to discuss the things that happen to them that is a pelvic oriented issue.
Thank you so much for all of that. I think it's really important to, and for sharing that statistic as well, the 2%, that's incredible and really unfortunate. I hope that we can continue to bring together like these educational aspects, whether it be for inspiring girls to pursue medicine, and then empowering them as well to be proud of their and be willing to open up and talk about their periods and not have to worry about that as much. Yeah, that's incredible. I think, Isabella, do you want to take away the next question?
Sorry, a cat just jumped on me. Okay, so we're now moving to Jessica Norden. So we're hoping that you could bring, in addition to Karen Sugar, a global perspective to this conversation. All over the world, periods are stigmatized and deemed taboo. Could you speak as how this stigma has worsened since the beginning of the pandemic, and how the psychological impact from the shame associated with menstruation has worsened since the start of Corona? Karen Sugar talked about this a little bit, about the psychological aspect of being shamed to just menstruate. And so it would be great if you could speak on those.
Yeah, so my organization, it's called Chapati, and just to kind of like talk about Chapati a little bit, it's the Nepali practice / tradition of shunning a woman when she's on her period to a cattle shed or a hut for up to 2 weeks. This is because she's considered to be like dirty, untouchable. Women, just as an example, women are not allowed to like touch family members, enter the kitchen, eat the same food, look in mirrors, go to large gatherings or school. This is like due purely to like superstition that the women are going to like curse everyone, bring bad luck. And so like for us during the pandemic, we found that like now that we can't bring period products to Nepal, that a lot of girls are being like put to shame in these huts, which is super hard and really ridiculous, and it's hurting them as well. And like a lot of the girls that we've talked to through our contacting Nepal, some of them they actually believe this tradition, which is like really crazy.
Yeah, and I think you were mentioning to us earlier how you have been still trying to work in the North Texas region to do drives and things like that. So if you want to speak a little bit about that, that'd be great.
Yes. So social media is a super powerful thing, like we were talking about earlier. I just have been making posts on social media, and people have been like, yeah, I have period products, and we've been able to raise almost 15,000 individual period products, so like cups, pads, tampons, and I've been doing porch pickups, so people will like message me like, this is my address, and then I'll go and like pick them up. And one woman, it was super sad, she really needed pads, and she messaged me like, I can't go to work without pads, and I just happened to have 15,000 pieces of pads and tampons in my room, so I went ahead and brought some over to her. And it's just sad to see like so many underprivileged women in the community not being able to like go to work, go to school, even in 2020.
Yeah, that has been a common thing that's happened everywhere, is from my understanding. Women can't go to school if they don't have proper menstrual. It's like an ever-going effect,
Yeah.
which limits education, and it's a really sad.
Can I add to that?
Yes, please.
When it comes to those the negative social norms that are attached to our menstrual cycle, it becomes very dangerous, because what they do is they continue to add to the miseducation about the menstrual cycle. And when girls are unable to like speak about their periods openly, they're just figuring it out as they go. You know, so the more and more we entertain and engage those negative social norms attached to it, the more we put ourselves in danger as well as them. Because what happens is they're not going to the doctors for their annual. They're not talking to their doctors. So they're not talking to their doctors about the issues that they're having, especially if she has a male doctor, you know, or even as women, we're carrying those stigmas and taboos along. Because I have fathers that literally have reached out to me. And like I have one guy, he was going to, his wife told him to take his daughter a change of clothes to school, but don't tell her that, you know, she started a period. This is her father. Okay. Surely he knows, you know what I'm saying? But when a father speaks to his daughter about her menstrual cycle without those negative social norms and can tell her he's excited for her and the woman that she's going to become in that, it looks completely different than him giving her a little dab and running out of the room. Because now she's ashamed of who she is. This is a part of who we are as women. But when you're training these girls and you're raising them into those negative social norms of keep quiet, it's dirty, it's this, you're adding to not just what's going on mentally, but what happens physically. Because a lot of times those health issues, which I'm sure the sister who's the OBGYN can add to that, when they can catch things early, you know what I'm saying, she has a better chance of controlling it and or just alleviating it. But we're not taught how to speak out. We're not being taught that your period is one of the best things that happen with a girl. You know why? Because it is your body's alarm system. Okay? If anything's going on in there not right, your period responds accordingly. That's why they come out so painful or so much at a time. It's telling you something else is going on. And if we know this and we can openly have these conversations, then the girls can get to their OBGYNs sooner than later. Then the girls can get the treatment that they need, if any, because sometimes it's just linked to diet, poor diets. You know, but if we're not having those conversations, we continue to engage in those negative social norms that are put out here about our periods, is going to continue to be a detriment for women, especially inner city girls and girls that are facing poverty worldwide.
You know,
sorry.
I was just going to add one thing that we have started to do in the last year is include men and boys in our trainings.
Yes.
So we have young boys in the schools also learning about healthy periods and menstrual health management. And I have gotten some of the sweetest notes from these boys that say, you know, now when we see our sisters having a problem, we know what it is, and I give her my sweater so she can cover up, and I take her to the head teacher. And, you know, that is where we're going to get the change, right? Is educating young men and boys on this issue. I mean, we're kind of past some of the older generation, you know, but getting to those boys early in junior high is really like the ticket. So, and so many of them were like, had no idea about periods at all, didn't even know they existed. And you know, the machines that we use to make this pad, we get them from India. This man in India created this, he's called the
I'm familiar with him.
Yeah, I call him M, but he created this whole industry around this very rudimentary machine that we use to make these pads. Well, our program director went to India to learn on them and understand them and see how they all work. And you know, his story is he got married and he had no idea about periods, nothing, but he saw his wife acting really weird every few weeks and hiding things. And finally he said, "What is all this?" And she showed him a pile of rags. And she said, "This is what I do every month." And, you know, where I work, women are forced to use rags, leaves, mattress stuffing, newspapers, unless they have access to the healthy period pads that we produce. And, you know, that is unacceptable and undignified. But it's educating boys at an early age as to what this is that really will start to change that dynamic of shame and mystery, and, you know, which is linked to reproductive health care in general going forward. If girls don't understand their menstrual health, they don't understand their reproductive health. And if they don't have access to menstrual health education, they have a much greater chance at having an early pregnancy. Right. So we also do reproductive health care trainings with these girls as well. And it's pretty much the only time they can see a doctor, ask a doctor questions, or learn about their bodies is when we visit the school with a doctor, with a local doctor.
My sons are a big part of my happy period. I mean, my sons help me when I do pop-up shops. They can be present, and they'll communicate like to the women like what to do. I mean, my 11-year-old knows how to use my uterus and insert the menstrual cup as a demonstration. When my moonshine shows up, they know they make me teas. Like, "Mommy, you need some tea," especially if I get the mood swinging on them, okay? You know, but they know how to make the teas. They know which teas to go get. You know, they'll bring me food. Like, I can go sit down, and that has to become a norm for us. But a lot of times the women are our biggest problem because we shut them down. Because we're stuck in the negative social norms, and we have to change that for ourselves to get them involved and each other.
Change is hard. You know, I mean, I've been doing this, I founded the organization 10 years ago. So, and, you know, I work in a tribal area, very culturally conservative, you know, a lot of pushback in some ways. But I also see that people do change, including men, including older tribal leaders in northern Uganda, can really come around, right? If you give them the chance to come around, right? So change is painful. It takes a long time, but starting with young men and boys and educating them and offering them the opportunity to grow and evolve, they will take it. You know, they will. I also think. Become better partners and better citizens, and women and girls will benefit from that. Yeah.
I also think that one of the things that contributes to this is also how we create that societal wise, and what we see in the entertainment industry, what we see in our culture, which really kind of can trickle down into what men and women or boys and girls think of just health in general, but women's health. And, you know, I have 2 little boys, and, you know, I feel that it's my duty and responsibility to make sure that they understand what that actually means, and for them not to be ashamed to discuss a normal physiologic. And that's what I try to focus on when patients come in. This is a normal physiologic part of your body, and you should feel empowered by it, because like we were just saying, that it can lead to certain issues and conditions later on in life, such as bleeding issues, infertility, and so many other things, endometriosis. But if we don't have a good foundation of what the menstrual cycle is and how it can be changed and thwarted, and what we can do from a healthcare provider standpoint to offer options to help correct it, or whether we send you to a nutritionist or, you know, acupuncturist when there are some things that are wrong with the with the menstrual cycle, but it is important to make sure that we start these conversations between also women. I think that there are some women too who don't do the best at making sure that there's power to the pelvis in other women, right? So we need that in our community as well.
Thank you to everyone that's sharing all these insights. We've had a lot of engagement in the chat, which is super exciting. And quite a few people have asked, so how can young people get involved? So we've definitely been on the topic of start these conversations, right? With your brothers, with your friends, with your fathers, and try to create this conversation and the sense of comfort when it comes to talking about periods rather than a taboo. But if y'all would also like to talk about specifically how we can get involved in initiatives, whether it be drives or normalizing, increasing education, we'd love to hear some of that as well.
Okay, well, I can go first. We don't ship anything over because we make it all local and source it all local, but we are so lacking in funds for the Healthy Periods Initiative. So if somebody wants to start like a Healthy Periods Initiative club on their campus or in their community and help us raise awareness and funds for what we're doing, sometimes like what we've done in the past is have like cool Zoom chats with some of our girls who are in the Healthy Periods Initiative, with the community member in the United States or in the UK, wherever it is. And those are really beneficial conversations to have because you can actually ask questions that are interesting to you, and you can hear from the women and girls that participate in Northern Uganda in our program. So there's this really cool exchange of information because this connects us all as women globally, right? This is one, well, gender-based violence as well, which is sad, and many others, but this menstrual health connects all women. Like all women understand what you go through every month. They may not talk about it, there may be stigma around it, but everyone understands it. And so when you say that women, that girls are forced to, miss 70 to 90 days of school every year on average in the global South because of their periods, women get that. And it's also so detrimental to their future. And it's not rocket science on how to address this, right? This isn't something that we don't know, like COVID, where we're just all stumbling through this to try and find a cure. We understand what the needs are of women. It's just how to share the information and provide access, and resources. So we need some strong sisters and some strong groups to help us continue the Healthy Periods Initiative, because right now it's at risk of actually, we're running out of supplies and we don't have, we're not raising the money right now to buy more. So, that would be really helpful. I also think that getting involved with us as a volunteer would be amazing. And we also do internships in our office in Gulu. So of course, right now, no one can travel, but there are virtual opportunities. So I think this is a much broader conversation that I would welcome.
Karen, sorry.
Go ahead.
Go. Would you like us to, do you have like a messaging service that we could, or a message email that we could put in there in case someone wants to start a club?
Oh yeah, you mean like my personal email so they can contact me?
Yeah, is that the best way to?
Yeah, definitely.
Okay, all right, cool, we'll do that.
I'll get it after, but yeah, and they can also go to our website, and I would invite people to go to our website. It has a lot of information on how we're addressing menstrual health, because periods don't stop during COVID. So we have a lot of information posted on our website, and I think my email is actually on the website as well. But yeah, I would welcome anybody to contact me about furthering the conversation for sure.
Great. Yeah, we're gonna compile all the links that everyone's sending, and your email and whatnot in a doc.
One last thing I'm going to say is that, it's really important to empower and work in your local communities, but I would really urge you to not forget our global sisters who, really have very little resources, if any, to manage their menstrual health. And this is one way that you can really help them continue their education and to be healthy.
Thank you so much. I think Ms. Jedi, you had something to say?
Yes, indeed. For me, it's the same, and I think like all of us, for the most part, you guys can definitely hit me up on in any of my social media platforms @ empower you period. That's 3 words, empower you period. But also check out the website www.empoweryouPeriod.com/giving-works. What I'm looking for is someone who can help me get sponsorships related to natural fem care, to be able to give back to inner city girls here. So if somebody can help me with the sponsorships of that. But even more so when it comes to the young people, I'm also looking for, high heel platforms or boots on the ground, honey. I'm an exhibitor in a lot of places, and for them to hear it from girls their ages, that's really powerful. I have a couple of girls from my rites of passage who are chimed in today that help out on the ground, even when it comes to collecting, like creating the boxes and everything to put in drop box locations for people to donate outside of my website. They can purchase and donate directly from me. That's our pay project online at that same website, empoweryouPeriod.com/giving-works. But also I'm looking for girls who are interested in being a part of the Because She's Worth It club right here in Dallas, Texas. But you don't have to be in Dallas to be involved, engaged in the work that we're doing to promote awareness to the use of natural period products and getting people involved and holding people accountable to help us out in promoting the use of those plant-based period products. So I'm very active in my social media. I'm very active behind my Facebook wall, and you can also email me at info@empoweryouPeriod. I'm always doing like local workshops. I don't do the bigger ones, but I do small groups. And of course, the small groups are led with the, checking temperatures and writing them down, okay? So I'm still on the ground in that regards with small groups. I host period parties pretty much to this day. So yeah, get at your girl through those, those avenues I just gave you. And then we can talk more offline.
Wonderful. Ms. Jessica Morton, if you want to share anything as well, since you're a grassroots nonprofit here in Dallas, about how youth can get involved.
Yeah, so definitely we're looking for volunteers, just as the same. We're looking for volunteers specifically who know how to sew, because we want to make reusable hygiene products. We're looking for volunteers who can spread the word. We're going to start doing webinars pretty soon, so we're super excited about that. We're also looking for monetary donations as well, because even though we have all these pads and tampon donations, it's pretty soon they're going to run out, and we're going to need to get more. Yeah, and you can hit us up on our website. It's chhaupadi.org. And then that's the same for our social media, Facebook, Instagram, Twitter. It's chhaupadi.
Wonderful. Thank you so much. I hope everyone here is kind of getting inspired by all of this. And once again, we will be sending out all of these donation links and these contact information for y'all to check them out later. So I had a question, actually. So I was on a panel conversation the other day, and they were talking about how, as we're addressing like these global issues, for us in our communities, it's easier to know what our neighbors need, right? What our community is like, and what its necessities are, and to address those. But for global communities, there was a conversation. Someone was just trying to get products and just donate them to these women, but they didn't actually realize that women in Africa actually wanted like economic empowerment. They wanted job security so that they could go out and buy these products on their own. So I think there's a lot of understanding, like, what does that global community really need, right? We don't want to just go in there they call it white savior complex, right? Like these INGOs just kind of, in their little Silicon Valley bubble or whatever it is, like plan out these systems and then just go in and impose them. So how do we work towards, and anyone can speak to this, how do we work towards really understanding what the community's needs are and then addressing those?
Okay, so I'm going to just start with this because this is like my wheelhouse. I also am a professor at University of Colorado, so I teach philanthropy and ethics, along with gender and development and human rights. So, the things that I've learned is what you just brought up is really, really important. So that's one of the beautiful things about HPI is you cannot send products over to Africa and solve or address any issue at all. Doesn't work. It's not a sustainable framework. Also, you have to understand what the culture and the community needs. So tampons are not relevant. Diva cups, not helpful. When you look at reusable products, 90% of the women I work with don't have access to consistent clean water sources, and sometimes even soap is not available. So we work in refugee camps as well on the DRC and South Sudan, which I didn't mention, but that's a very vulnerable population. And I've met with girls that, got their period for the first time in the refugee camp near South Sudan. And they said, we don't even have soap. And someone gave me a rag and I don't even know how to clean it. So we do make monthly drops there as well when the camps are full. So those are things to consider, because I get a lot of people that say, I have a lot of products, and what about Diva cups, and what about a reusable product? And, you really have to be educated about the population that you're serving, that you want to work with, about what their needs really are. And so along with, the HPI is only one component of our program, because we also do literacy, leadership development, and then economic activity. And the HPI actually has a microfinance, like a micro enterprise component to it for young mothers who missed out on the opportunity to go to school. So they make the product, they package it, it's called Lucky Girl, and then they sell it as their economic activity. And they've been able to provide for themselves. We also train them to go into their villages and districts, because we can't get everywhere, of course, and go back in and become educators and facilitators as well. So not only are they able to earn a living, right, and change their lives, but they can also go in and educate and facilitate conversations in their villages, along with, so when I created the program, my idea was, I don't want to create just an economic endeavor. I wanted to make sure that women that cannot afford pads, schoolgirls, refugees, we do Gulu Women's Prison because they literally have nothing. I wanted to make sure that those women were served and that those pads were free and came along with a lot of education and support. So what you said is really, is very spot on. You have to understand that working in global communities, what the priorities are for that community, what's culturally relevant for that community, and what actually creates sustainable development. Not the Band-Aid approach, which is a very, entrenched traditional form of philanthropy. It's a kind of a Band-Aid approach. We drop food, we send in supplies for a while, we dig a well here and there. And those are all Band-Aid approaches that don't really create sustainable development or empowerment.
Thank you so much for speaking to that. Any other one of our panelists, if y'all have anything to add, we would love to hear you.
I just want to say, I totally agree with what Karen just said, because, for us, when the pandemic first started, we sent a box of pads to an orphanage in Nepal orphan homes, and, that will help them for, a month, for that period, for that month. But then, what they need is for someone to go in and educate them about periods, period poverty, chapati. But unfortunately for us, because of the pandemic, we can't do that. We're gonna have to wait until after the pandemic is over. So hopefully soon, fingers crossed.
Yeah, definitely. I think something that the pandemic has kind of allowed us to do is have these virtual conferences, like what we're doing now. We have people from India and London and so many places joining us. Is there any way that we can get involved with international advocacy and development virtually or online? If y'all have any avenues for that, we'd love to hear.
Oh, I think everything is so virtual now that, from philanthropy and fundraising to education to having community meetings, internationally, that is kind of one of, there's always beauty in the madness, and kind of one of the things that have come out of the pandemic, is that we've all managed to maintain connectedness and actually furthered some of our goals that way. So again, anybody that's interested in continuing a virtual conversation, and, you know, with myself, with Women in Gulu, when, you know, hopefully I can go there soon, or travel there, or create a club, or help us in any way, I would invite you to go to our website, which I chatted a link to it just a few minutes ago, and I would welcome the opportunity. It's wgefund.org. I should mention that. But yeah, I think that having a global conversation is easier now. People are used to it and like it. And I think there's a lot of value in continuing that, even post-COVID, to just adding it into the mix of how to help, you know, whether it's virtual or in, you know, in person.
I want to add that also from the inner city girl side, it's very big globally, but I think like sometimes the girls right in our own communities are being overlooked, and working in inner city schools, it's very important to understand, yes, they do have access to school, but they're also leaving home, and their health issues are ridiculous as well, because sometimes most times they're creating MacGyver pads. Okay, I don't know if y'all remember about, you know, MacGyver pads is you wrap the tissue around your underwear. So you're walking around with whatever you can find, you know, whether it be at school or whether it be at home. I was giving away pads every month to girls coming to me about what they needed, you know, to go home with. Like I would give them a few to get them through the day, but they come talking to me on the side about just taking them home because they can't afford them either. And so I definitely want us to keep both sides of the world in mind when it comes to that. When girls, like for me, I create, one of the things is making sure that they're prepared for unexpected moments because they're uneducated about when their period is going to come and go. So I create these really cute stay ready carry cases, which I call their emergency pack. Because working in a school, what they have to do, if you're in the 2-story schools like the ones that I worked in, the girls are coming from the back of the school upstairs. They have to go all the way to the nurse's office, which is downstairs in the front of the school. So imagine trying to get from here to there, okay, with a period stain on the back of your underwear. Okay, she misses a lot of days in school for simply the embarrassment of it, you know. So being able to make sure that these girls are not forgotten, you know, is really important. Being, you know, making sure that they know what they need. And inner city girls, a lot of times they're raising themselves because their mothers have to work 2 jobs, you know. So we become the community and we become the voices for them. And so I just wanted to throw that in there, to make sure that those girls are always included in the conversation. And I think things like this is really important, having this level of platform, because this is normalizing period talk. You know, my hashtag is Let's Talk period. And platforms like these, this virtual concept, I mean, it's amazing. And I hope to be invited to more panels like this because people are chiming in from everywhere. You know, and what happens is when you get girls and women and men that chime into these things, it helps us access those girls who don't have access to the internet, you know, because now they're becoming equipped to be able to have these conversations with the people around them who don't have internet access. Now they're being given the tools by virtual conferences like this that help them help other people get what they need and know what to do. Now, I know y'all didn't ask me for all that, but I get a little passionate. Okay, I'm gonna pull out.
I think, you know, what you bring up is shocking, that in the wealthiest country in the world, that's what we coin ourselves, right? Depending on how you
yes, that's exactly what it is.
That's the tragedy. And I think just from my perspective, what is really needed in communities like Dallas and with girls in underserved communities in inner cities in America is better advocacy. Right? You need to be lobbying your member of Congress, your senator, your state reps. You need to create a lobby day around menstrual health in every city in America. I mean, we should do that. Anyway, and make sure that these issues are on their desk, right? And that, because this is not because of a lack of funding in America, right? Like it is in many parts of the global South, where it's literally a lack of funding and access. And but here it's a lack of will. It's a lack of political power. It's a lack of participation. It's a lack of democracy. And it's it's a tragedy, and we should do a national lobby day around menstrual health. So anybody that wants to help organize that is awesome.
The young lady that was on, I can't think of her name, so I apologize, but she's our OBGYN that's on the line. Like, she said it best, like the health disparities that are in these communities, like, it's real, like, you know. And for me, I mean, I have great doctors, but they don't accept Medicaid, you know. And so for the girls who are coming through Medicaid, you're also dealing with those women being overworked, you know. Like, I just had a friend who passed. He's in the hospital, especially with this whole COVID, you know, concept, and you're crying out for help and you can't even get it because they're under, you know what I'm saying, there's not enough people, and or they're overworked, so they're being oversighted. I remember when I was in my 20s, I had Medicaid and I found out I had fibroid cysts. They were the size of like golf balls. I had about 3 of them. You know what I was told? I was told, oh, it's okay. I mean, they're not cancerous or anything like that. They're just there. You know, it won't really affect you at all. And then when I started doing research and understood how they can affect fertility, how they can cause miscarriages, how they can cause like really bad periods. But this is what I was told under Medicaid. Okay, and that's not to say that all Medicaid is bad, because I also understand that they're overworked, they're underpaid, and there's not enough of them. It wasn't until later when I met somebody, a holistic doctor, who educated me and helped me use diet to even respond to it. Which is why I'm in these inner city schools, giving those girls like these things. I'm the one on the ground who's making sure that they get to the sister who's the OBGYN in her early. They don't even know, like, once you start your period, you should definitely be seeing an OBGYN. They don't show up until there's a problem, because there's no education wrapped around this, because they're being silenced. Okay, they're being silenced, so they don't know what to do. And so those are the things that, yes, we need advocacy around these things. There has to be, I'm trying my best to be the bridge between us and the OBGYNs. I'm trying to be the bridge between us and the importance of natural period products. And you need boots on the ground to do that, you know. When I'm sitting at a huge event like EarthX Dallas here, EarthX Dallas is huge. It's over like 10,000 people come to this thing. And me being an only person, it's a 3-day event. And I'm talking from 8 in the morning to 5 in the evening for 3 days straight. Honey, I'll be laid over. But the work has to be done. And that's what we need to, you know, to bring people in on being more comfortable, alleviating those negative social norms, to have those conversations. And like you said, getting those politicians and stuff involved. Now, I'll be honest, honey, I need a little guidance on that, because I'm typically just the boots on the ground. I don't know how to, you know, to pull those kind of things in.
Reach out to me.
I can use the help.
Okay. Reach out to me. We can talk about it. And you need some interns. You have all those great universities all over Texas that probably have internship. You need to, you know, create a little document about why you need interns and what you do, and post it, and you'll be getting interns from all over.
Yeah.
Thank you for that.
I'm definitely interested. Yeah. Sanjna asks in the chat, although the pandemic has amplified healthcare disparity for women, how is this prevalent in everyday life? Is menstrual care stigmatized to a certain extent in the healthcare industry as well? So this seems like it would be really directed towards Dr. Jessica Shepard.
Yeah, no, I think that's a great question. Healthcare industry is very complicated and complex. And even, you know, from the physician level, we do see that there is an organizational insurance level type of healthcare disparity that I very often try to speak out against. So I'll give you a quick example. I see a lot of patients who have fibroids, and innovation and technology has allowed for certain surgical procedures or medications or whatever it is to impact quality of life and make sure that we're helping women. And so what you'll see is that insurance companies, there will be some people will have the same insurance carrier, but if they're in the Southeast, usually in the Delta states, like so Mississippi, Alabama, South Carolina, sometimes Louisiana, they're, because of where they live and they know that there's an increase in lower socioeconomic status, they won't cover the same procedures and medications, even though it's the same insurance company, that you would find in other country, or some other countries, other parts of the country. And so that's like just a quick example of how you'll see big organization insurance companies make disparities within their own coverage. And so it's things like that, that I find at the level that I'm at to be responsible to speak out to those injustices. And then another level at which I see stigmatization when we think of menstrual care or periods or heavy bleeding is sometimes, and not all, but sometimes gender within healthcare. So for example, your PCP or your OBGYN, sometimes a gender issue might bring out that kind of disconnect when it comes to women who want to discuss some of their most intimate issues and things that affect their quality of life when it comes to menstruation, whether it's from a hygiene standpoint, whether it's from quality of life, or maybe they're just bleeding very heavily. And I've had patients who have said, oh, I've gone to other physicians that are either, maybe it's an age disparity, maybe it's a gender disparity or difference. And when they give them their complaints or what's going on in their life, and there's kind of shoot off or told, oh, that's not such a bad issue, just do this. Or maybe you need to, if it's an intimate issue, or just don't worry about that, don't have sex then. So there are many levels at which I'll see that from patients that I have encountered in my office, that we definitely need to, oh yeah, thanks for letting them know what PCP is. PCP is primary care provider. That's just like your family care doctor, your internal medicine doctor. So I think that there are many levels at which you'll see disparities when it comes to women's health. And it's so sad to me, because we're supposed to be the level at which you go to get healthcare, or you go to get an opinion, or you go to get treatment and management for some of your issues. So I do find that there are, and I think that's just society. You're going to see it at every level. You're going to see stigmatization. You're going to see healthcare disparities at every level of healthcare, which is why it's a healthcare disparity. So I am very in tune with that, because I never want myself to be blinded from the fact that the circles that I'm in, whether it's administration, whether it's organizationally, or whether it's from a physician standpoint, that I'm blind to that, and making sure that I'm always aware. So that's why these panels are so important, because again, it's bringing in ideas and suggestions and concerns and issues that are happening at all levels, that we can hear them generated. And so we can put that to mind and make sure that we're addressing them from all levels, because it's never just a one level issue. It's very multidimensional and it's very complex. So these are the types of conversations that need to continue, and then it's going to facilitate change.
Mm-hmm. Thank you so much for sharing. I think we've covered, because of the very diverse backgrounds that our panelists have, we've covered such a wide range of issues related to period poverty and menstrual education, and like super, super grateful for that, and super thankful to all of y'all for staying on and being part of this and engaging so much in the chat. I hope that a lot comes out of this. And so as we're nearing the end of our scheduled webinar, which sucks because I'm sure we could talk for at least a couple more hours about all of this. But I invite our panelists to kind of give one final statement, like take 3 or 4 minutes to just kind of wrap up everything. And then we're going to hear one message from Shira towards the end, and then kind of close off.
Yeah, I'll start off actually. I will not be 3 to 4 minutes. I'm usually very bite-sized. I like to make it bite-sized so that everyone can remember what I said. But no, I think 3 or 4 good points that I could, that I would want everyone to take away from this panel is that we need to continue these types of forums and settings, because this is where we generate thought. This is where we get genius ideas from all different avenues, perspectives. And I love the fact that this was global. I love seeing everyone remark in the group chat where they're from, because this shows power to purpose in how we can all some of the same overlying issues that we need to address. And the way that we can do that best is to collaborate from a global perspective as well. And then 2, I would love to say, this is usually my kind of tagline and thing that I love to enhance, is power to the pelvis and the power of the pelvis, because there's so much power in pelvis. And if we can create some of that ripple effect, where we can keep generating that message. I love to say that some uncomfortable conversations, the more that we discuss them, then the less uncomfortable they become. And so if we can make menstrual hygiene, period poverty, pelvis, anything to do with the pelvis, something that is not uncomfortable, then we have made significant impact. And then thirdly, I would like to say that each one of us have kind of our purpose in what we do and what we do best. And so if we can intensify that and all of us still impact, we can really make some, again, global change, because we're all hitting some different target within the same cohesive idea of, again, empowering women, empowering girls, and talking and how we can decrease that stigmatization.
Thank you so much. Oh, yes.
One of the things I like us to walk away with is my favorite hashtag, let's talk, period. The more we talk, the easier the conversation becomes, and the faster we can alleviate those negative social norms. Those negative social norms, again, they affect us mentally, physically, and spiritually. So the more we talk, period, the faster we can alleviate those social norms, and it improves it improves our health, you know, in mind, body, and spirit, but also making sure that we are willing to invest in menstrual health and hygiene, invest in the boots on the ground that are doing the work for that, and encourage others to do the same, and definitely invest in your health by using safe menstrual health and hygiene products. As you move to the world, look here, I always say, if you can't read the ingredients on the package, put it down, ladies. Put it down. So, you know, if it doesn't tell you what's in it, honey, let me tell you something. This is a public service announcement, okay? If you cannot read what's on your package, put it away. Continue the conversation by openly having that conversation. Ask your sister, if you owe me your period, you better not go in there and make a MacGyver pad. You better ask Teresa, let you hold a pad, and do so publicly, because over half the world is either starting her period, on her period, or has ended her period. So there's nothing embarrassing and shameful about your moonshine. And those are things that I want the ladies to walk away with here, is becoming more comfortable with having those conversations. And not just amongst yourself, you can be in the streets and have that conversation the same. So use the hashtags, let's talk, period, to alleviate those negative social norms, and get involved with organizations like mine and the ladies that are on the line as well, to help us have an even bigger impact in the world around us.
Well, I'm so inspired by this. I mean, I'm sure all the participants that have joined in are as well, but you know, it's always, you never know how these things are going to turn out. And all of you ladies have just really inspired me to work harder and be smarter and keep going. And I really appreciate all of your insight and wisdom and everything that you're doing. And if anybody wants to work with me on doing a lobby day in your state, around menstrual health, which I think, you know, I worked for Colorado NARAL for a long time, and we do a lobby day around the country. And so I'm intimately familiar with how to do them. And I would love to partner and collaborate on bringing the issues around menstrual health to the forefront of our political talk. And so reach out to me. Another thing is that the HBI project is completely portable. So, you know, we could do this in other communities, we could do this in other countries, not in the United States, but, you know, in the global South. So if there are communities that you know that experience, you know, period poverty or lack of access to menstrual health, and you want to talk about doing an HPI project there, let me know. You know, I sat with, the last time I was in Uganda, I got to sit with a bunch of, you know, 13-year-old girls that are part of the Lucky Girl program in the schools. And, you know, they tell me they're excited, they're vibrant, they're amazing young women, just like young women everywhere, right? And they want to be lawyers and doctors and judges and teachers and poets and artists. And, you know, the way they get there is by keeping them in school. And this is, again, not rocket science, and HPI has a proven track record of doing amazing things and having really great outcomes. And so I would love to continue the conversation with anyone that wants to start a club, have a meeting, have a virtual meeting, an international one. And my advice is to I think this conversation has been really cool from the perspective of you have to think locally and globally. And I think as women, it's our responsibility to advocate for women everywhere, girls everywhere, to have access and information and to live healthy lives and to not be ashamed or stigmatized or be in any way deterred from living, you know, up to their full potential, right? And that has to be about menstrual health and reproductive health care. So thank you for having me.
I just want to say, like, I'm super honored to be on this panel today. I'm just so happy to meet like such strong women here today. And if anyone wants to collaborate, I'm in North Texas, so just shoot me a message, like email me or message me through Instagram or something, and that would just be amazing. I would be super happy.
Thank you for being here. Yeah, Isabella, go ahead, sorry.
Oh, I was just gonna say, yeah, definitely. I love all the connections we've been making over the call already. I will be, or Shreya and I will be compiling a list of all the, we'll be taking stuff from the chat, links and whatnot, and also connecting people, emails and whatnot. And definitely Ms. Karen Sugar will reach out. The North Texas Coalition is interested, and yeah, we're definitely going to get involved with our local Dallas groups as well. Thank you so much.
Thank you to everyone once again. I think that there's all of this conversation that we're generating is really, really important. Shira, I'll get to you in a second. So I want to encourage everyone to, whether it's policy work that you're interested in, right? There's avenues for that. Whether it's making menstruation and products sustainable, there's avenues for that. Whether it's doing drives in your community. Social media, as someone mentioned, is an extremely powerful tool to get involved. So look up organizations. We'll be sending along a lot of contacts. But whatever sort of advocacy that you're interested in, there's a space for you, and there's a much needed space for you to fill that and get involved and support this movement. So we really appreciate y'all being here. Go ahead, Shira.
Well, I just wanted to reiterate what the previous panelists and moderators have been saying. This has just been incredible. I mean, every session has just been incredible of this webinar series. And I mean, this conversation is so necessary and unfortunately has been so hushed and quiet for so long. So I hope that not only will all of us be taking, you know, the resources that we've learned and the information we've learned, but even just the subtleties of just being able to have this conversation publicly and, you know, trying to not being scared with your friends, you know, talk about this when you're in public. Like I love that. So I just wanted to say thank you to all of the returning faces who have been with us on previous sessions, and we are thrilled to see all of the new faces who are here. Our webinar series continues this week. So coming up on August 13th, Girl Up University of Maryland is hosting a discussion about the impact of COVID-19 in women's prisons. And then on August 15th, Girl Up Mexico is hosting a discussion about Latin American women in lockdown. You may have seen on our website, so we were scheduled to have an event tomorrow discussing the impact of COVID-19 on conflict-affected girls' education. However, our panelists are actually in Beirut right now and are suffering from the massive devastation from the explosion. So that panel is going to be pushed to be postponed until next week. But please, I implore you, go to our websites, sign up for these events. Also, all of these events are accepting donations, and the money is going directly towards our panelists and to the participating organizations. So your presence, your money, it's all really necessary and needed. And thank you again. We hope to see you soon.
Bye, everyone. Take care.
We out.
Thank you.
Thank you.
Bye.
Bye.
We'll be adding the doc to our link as well on our Instagram.